Feline hypothyroidism. In this video we'll cover what it is, what effect it has on a cat, how it's diagnosed, what the treatment options are and what you should look out for. And if you stay until the end, we'll cover a simple test to monitor your cat's progress with treatment depending on which treatment you go through. Feline hypothyroidism is a disease that results in high metabolism of cats caused by sustained high levels of thyroid hormones in these cats. In the vast majority of hyperthyroid cats, benign tumours known as adenomas in the thyroid tissue in one or both of the lobes of the thyroid gland become independent of the normal control. These adenomas produce excessive levels of thyroid hormones T4 and T3. In normal cats, the production of T4 and T3 is controlled by the brain via TSH, or thyroid stimulating hormone. So what are the effects of hyperthyroidism? Hyperthyroidism affects 6 body systems in cats. Due to the high metabolism caused by high levels of circulating T4 and T3. Think of it like revving an engine too high all the time. A lot more fuel gets burned, and that's one of the effects that hyperthyroidism has on the body. The first organ system affected is the musculoskeletal system. Hyperthyroidism causes cachexia. So what owners and veterinarians see is muscle loss occurs as the body needs extra fuel due to the higher metabolic rate. Because what the cat's eating can't supply all its needs, the body then starts to look for spare energy and it will prioritise breaking down muscle, and if there's any fat, it will also break down fat. The second system affected is the cardiovascular system, so the heart, causing myocardial hypertrophy, which results in an enlarged heart muscle, and this can actually cause a reduction in the size of the heart chambers because the muscles become thicker. This may result in the heart being less efficient, and hyperthyroidism also causes high blood pressure. Some cats will develop a cardiac murmur, and sometimes you may get a blood clot due to the cardiac murmur. Rarely it is possible for a blood clot then to move out of the heart down the aorta, the main blood vessel, down to where the aorta branches off into arteries that supply both hind legs. Now, if a clot lodges there, it can block blood supply to either the left or right back or hind leg, or sometimes both. So they call that a saddle thromboembolism. And if that ever happens, what you'll see is your cat is very painful. And if you compare the temperature of the front feet by holding them in your hands and then feel the temperature on the back pads or feet, you'll feel that the back feet are cold. If this happens, this is an emergency and you need to get your cat to your veterinary clinic or to one of the emergency critical care veterinary clinics if your clinic's closed as soon as possible. The third system affected is the gastrointestinal system, and hyperthyroidism reduces the transit time for food. This means food moves through the digestive tract faster than in a normal cat. This causes reduced absorption of nutrients and leads to cellular malnutrition and often diarrhea, as the gut does not have time to absorb the water to produce a solid stool and to also absorb the nutrients from the food because it's travelling through too quickly. The liver also can be damaged by hyperthyroidism in cats. The kidneys are the fourth system that can be affected by feline hypothyroidism, resulting in a higher GFR or glomerular filtration rate due to the high blood pressure that the cat has. This may hide underlying kidney disease. The kidneys may suffer hyperfiltration injury in some cases, and the kidneys are not able to concentrate urine often. The final two systems that are affected are the nervous system and behavioural systems. Cats may show irritability, restlessness, and sometimes aggression due to hyperthyroidism. Hyperthyroidism's distribution is global. There is not any one area of the world or country that is affected more than any other. As far as breed predilection goes, there is no breed that is at any higher risk than any other breed to acquire feline hypothyroidism. and both sexes appear to be equally affected. The age at which cats are diagnosed with feline hypothyroidism varies, but the range is between 4 years of age up to 22 years of age, and the average age is around 13 years of age. However, it is extremely uncommon for a cat to be diagnosed as suffering hyperthyroidism that is less than 6 years of age. Now, the historical signs that owners will notice are weight loss, polyphagia, that is increased eating, vomiting, diarrhea, polydipsia or increased thirst, sometimes tachypnea or increased breathing rate, hyperactivity. There may be times where cats suffering hypothyroidism run around flat out. One of my cats would do that at 11 o'clock at night, just be sitting there and suddenly get up and run around the room several times. Now, the physical findings that veterinarians are looking for is a large thyroid gland noted on palpation of the neck. And in 70% of cats, both thyroid lobules are enlarged. Poor body condition is usually noted, that is skinny ribs, bones protruding. Listening to the heart, also veterinarians may hear a heart murmur, and they can hear an increased heart rate, which is known as tachycardia. And there may also be an abnormal cardiac rhythm known as a gallop rhythm. It'll also often be the case that the coat is unkempt and dull looking, and often the claws will be thickened. What are the risk factors? Well, no one knows why feline hypothyroidism occurs. However, some reports have linked feline hypothyroidism to some canned food diets. The other risk factor is aging. Now, feline hypothyroidism also can look similar to a couple of other diseases. So the differentials for a cat that may have hypothyroidism includes cats that have hepatic disease or renal disease, diabetes, and also cats that have cancer. And for that reason, to diagnose hypothyroidism, your veterinarian will need to take a blood sample and send to laboratory or run it in-house. And they'll look at a number of enzymes, and they'll also want to measure the thyroid T4 level, what is actually known as the total T4 level. Please see your veterinarian for a blood test. Results expected in a hypothyroid cat are an increase in total T4 or thyroid hormone level in either the upper range of the normal reference range or beyond the normal reference range. Please see a veterinarian for a blood test. They'll either send the blood sample to the laboratory or they'll run it in-house if they have the equipment at their clinic to do that. There may also be some liver enzyme increases, including ALT, ALP, and AST. We often see an increase in blood urea nitrogen and creatinine levels also. There are 5 main treatment options for feline hypothyroidism. The first option is oral medication, either carbimazole tablets in some countries or methimazole tablets. Methimazole is also available as a liquid and can be compounded into a transdermal gel that can be applied to the skin of the inner ear for cats that are aggressive when trying to give tablets or liquid by mouth. Radioactive iodine therapy is the second option. This is performed at special veterinary hospitals by veterinarians that have specialised training in the treatment. It is the one treatment that may cure hypothyroidism in cats, according to feline medicine veterinary specialists. How does it work? Well, iodine forms part of the thyroid hormone. When iodine is given, it specifically targets the thyroid gland. However, usually oral medication will be used for several weeks first prior to radioactive iodine therapy to ensure that as the hypothyroid state is brought under control, that renal disease is not unmasked. Cats that have hyperthyroidism usually have higher blood pressure, which can damage organs such as the retina and affect vision. However, sometimes higher blood pressure improves kidney function in cats that have some kidney disease. Because of this fact, Blood tests prior to starting treatment for hyperthyroidism in cats may not indicate kidney disease until later, when the blood pressure is no longer high due to controlling the hyperthyroidism with medication. This is why radioactive iodine treatment is not usually given immediately until the response to hyperthyroidism treatment has been assessed with medication that can be adjusted. The reason for this is, with radioactive iodine therapy, you can't reverse it once it's given. However, with oral medication, whether it's tablets, liquid or transdermal gel, if we detect kidney disease, we can adjust and lower the dose of the medication that's being given to control hyperthyroidism. So it's a safety measure or precaution, if you like, before going to radioactive iodine therapy. For further information on radioactive iodine therapy, please see our video on radioactive iodine therapy that discusses the treatment in more detail. The third treatment option is, in some cases, surgery may be performed for cats with hyperthyroidism, especially if they have an aggressive adenocarcinoma. However, in the vast majority of cats with feline hypothyroidism, it is caused by an adenoma, and these changes are not amenable to surgery because they are not one discrete tumour that can be localised and identified, but they are diffuse benign tumours that are interwoven between normal thyroid gland tissue. So it's not possible for veterinarians to, with an adenoma, usually to go in and identify which part needs to be removed. So surgery is not usually performed for thyroid adenomas, but it may be for thyroid adenocarcinomas, which are the aggressive tumours. But as I said earlier, only 1 to 2% of cats with hyperthyroidism have an adenocarcinoma. Now, the final treatment option is dietary modification. There is a very low iodine level cat food produced by Hills called YD. This food is very low in iodine to the point that it limits the amount of thyroid hormone T4 production that can occur in the thyroid gland, and thus controls hyperthyroidism. This has been used for some cats where cost constraints may prohibit radioactive iodine therapy, or where adverse reactions to oral medication results in oral medication not being suitable. Possible complications, if not treated for hyperthyroidism in cats, may include congestive heart failure, renal damage, vision loss due to retinal detachment from high blood pressure, constant diarrhea and vomiting, and death. Complications from surgery can result in possible hypoparathyroidism, where not enough parathyroid hormone is being produced. Hypothyroidism, where now the cat is not producing enough thyroid hormone, which can be treated with thyroid hormone tablets. And the other risk of surgery can be laryngeal paralysis, because of some of the critical nerves that travel close to where the thyroid gland is located. Hypothyroidism, that is not enough thyroid hormone being produced, is a possibility with radioactive iodine therapy. And again, it can be treated by supplementing with thyroxine tablets to replace the thyroid hormone. So the simple test that you can perform at home, and it won't cost you anything, but it'll give you valuable insight into how your cat's health is, whether they're diabetic or hyperthyroid or having renal disease, is to weigh your cat. And the simplest way to weigh your cat would be to pick your cat up and hold it and weigh yourself and your cat on your bathroom scales. Then put the cat down, just weigh yourself, subtract your weight from the combined weight of yourself and your cat. That saves you having to try and get your cat to stand still on the scales. And I would do this every 2 weeks to at least every month. As owners or pet guardians, often we don't realise how much weight our cat's losing because we're seeing them every day and they're only losing a little bit every day. And even myself with my own cats, I've been surprised sometimes when I have gone to weigh my cat and found that the weight loss had been maybe more than I'd expected. Now, if there is weight loss continuing, you need to go back to your vet and discuss with them further treatment options or modifying the treatment. If the video was useful, please consider either sharing with friends and family who've got cats, liking or subscribing with cat guardians and cat owners. And our aim at Dr. Pawfection is to educate pet owners and guardians to improve their pets' quality of life.